for joining me on the second episode of Core Play and Lattes. Today we will be continuing our pelvic floor series, and we're going to be discussing Diastasis Recti. So what is it? Diastasis Recti is the separation of the rectus abdominus. So you have the linea alba, which is connective tissue of, you see that dark line that goes down women of color when they're pregnant? It's the dark line right down the center of the stomach. Well, because of relaxin when you're pregnant, that hormone causes the ligaments and the connective tissues in the body to relax. So with that being loose and getting, weakened, that gives the rectus abdominis walls the ability, it causes them to separate. So with that separation, you have a gap that forms there, and a lot of times there's a pooch. Women call it a pooch, I don't know. But that is what forms. And a lot of times after pregnancy, women, they try to do crunches and and then it just makes it worse. So I'm going to show you the way to self-test to see if you have diastasis recti, so you know that if you need to do some modification to your core exercises. Because if you don't, it's gonna get worse. So let's do the test. If you are pregnant when you're testing, you want to lie on your side and then transition to your back. Then you want to take two palpating fingers, place them about 3 inches below the navel. With that, got your 2 fingers. You want to put them downward, facing downward. You're going to take your opposite hand to support the neck, and you're just going to slightly lift the chin off the floor. And with that, I want you to press down. You should feel a slight depression, and then you'll be able to feel the separation. And so my lower abdomen, I have about a finger width of separation. And so then I'll relax. Then I'll go about 3 inches above my navel, 2 fingers pointing downward. Just check for depression first. And then take the opposite hand to support my neck. Gently lift the chin off. And fingers down. And up top, I have about a finger width separation as well. So that's the way to do the finger test for diastasis recti.